This episode of Intelligent Medicine is brought to you by Biomega Fish Oil from Biotics Research. For over 40 years, Biotics Research has been providing the highest quality supplements, surpassing industry standards. Biomega Fish Oil contains therapeutic doses of vital omega-3s in the triglyceride form, which is highly bioavailable. Biotics Research ensures maximum purity and freshness by managing their fish oils from catch to capsule, verified by rigorous independent testing. For more information, go to drhoffman.com/bioticsresearch. That's drhoffman.com/bioticsresearch for Biomega Fish Oil. This episode of Intelligent Medicine is brought to you by Future Farm Botanicals Liquid Turmeric Liposome Complex, a natural solution to chronic pain. Future Farm's liquid turmeric with liposomes and nanotechnology delivers maximum absorption for effective pain relief. Sourced and manufactured in the United States, this product contains 1,600 milligrams of curcumin and powerful antioxidant properties. This plant-based curcumin is used to possibly reduce inflammation, block proteins that trigger swelling, and intercept inflammatory pathways, significantly decreasing inflammatory responses. For more information and to order, call 888-841-7216, 888-841-7216, or go to myfuturefarm.com/Hoffman. That's future, P-H-A-R-M, myfuturefarm.com/Hoffman. Take advantage of Future Farm's buy two, get one free offer at myfuturefarm.com/Hoffman. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman, and the subject is Nitric Oxide. Some people have coined the term just say no. Well, in this case, no stands for nitric oxide. Nitric oxide could be a very, very important component in supporting our overall health. We're going to talk to an expert on the subject, and he has been a previous guest on Intelligent Medicine because he's an expert on EBT heart scans. He's a professor of medicine at David Geffen School of Medicine at UCLA, and he's the endowed chair of Preventive Cardiology at Harbor UCLA Medical Center. So it behooves him to look at preventive strategies for cardiovascular disease. He's on the editorial boards of several cardiology journals. He is very extensively published, authoring or co-authoring more than 50 books and book chapters. He's written more than 1,700 articles and abstracts. And he was named a U.S. News top doctor for cardiology. And he has accolades too numerous to enumerate here. So without further ado, here's Dr. Budoff. Welcome, Dr. Budoff. Thank you very much for joining us.
Oh, it's a pleasure. Thank you for having me.
Okay, well, our discussion today is about nitric oxide. So can you give our audience just a little bit of a primer on nitric oxide? What's that all about, and how might it have an impact on health?
Yes. So nitric oxide is something that the body makes. It's also available in some foods. It's what we call a vasodilator. It opens up the arteries in the blood vessels, so it improves blood vessel health. It's also been demonstrated to slow down the development of plaque in the arteries, or atherosclerosis. And we did some studies looking at its effect on blood pressure, because if it opens up the arteries, then blood pressure should come down as well.
Indeed. It actually has something to do with the Viagra connection, because originally sildenafil was a drug that was pioneered as a cardiovascular drug many years ago. But they did the studies, and they told the experimental volunteers, thank you very much. We'll compile the data, and we're going to send them home. And then some of the men in the study said, we're going to get a hold of some of this stuff. And that was kind of a serendipitous finding, because it promoted vasodilation in a very, very important part of the anatomy. So nitric oxide, in addition to dilating our blood vessels and helping control blood pressure and promoting circulation, it may also have some impact in other areas. So I guess nitric oxide has come into the public consciousness vis-a-vis some of the erectile dysfunction medications that promote nitric oxide. Is that a fair summation?
Absolutely. And then after that, it was used to help in the arteries in the pulmonary vasculature as well. So to open up the arteries, the same drug. So it's had a few entrees into our healthcare environment.
Yeah. So patients with a condition called pulmonary hypertension, they may ask their doctors, "Why are you giving me Viagra? I didn't ask you about that." And it turns out that, you can't just localize the effects. The effects are systemic, and they may actually help circulation in the lungs when that's a problem, right?
Absolutely.
Okay. So, what we're talking about here is a very interesting study that considers the proposition that maybe there are dietary constituents, or maybe we can concentrate whatever it is in the diet into a supplement. And that was actually the hypothesis, but it was unclear whether it was really going to pan out because, we know that certain foods help induce nitric oxide production of the body. What are some of those foods? And, is there any evidence that those foods really can help with blood pressure?
Well, yeah. So, there have been, obviously, there's a lot of nitric oxide in green leafy vegetables, and we've been told forever to, eat our veggies to be healthier. So there have been a number of plant-based dietary approaches for blood pressure control. And we think at least one of the mechanisms may be an increase in nitric oxide that comes with these green leafy vegetables. The way that we formulated this and the formulation we used a beetroot extract. So from beets, concentrated that to get a very high concentration of nitric oxide in a tablet formulation.
Right. So, this is actually the basis of what's called the DASH diet, which has been, adopted as kind of the standard dietary approach. It's a low-fat diet, lots of fruits and vegetables, relatively low sodium, lots of potassium, and for a variety of reasons, probably because, it's somewhat low calorie, and it's also got a lot of magnesium and potassium and other nutrients in it, but also because, things like arugula and beets are rich in dietary nitrates. So this has actually become kind of the go-to diet for dealing with hypertension, right?
Yes, absolutely. It's definitely at the top of our list for dietary recommendations when we talk about hypertension and high blood pressure. So
okay, it's a nice hypothesis is that maybe you can distill down that essence, those dietary nitrates, into a pill. Frankly, some people don't like arugula. They don't like beets. It's hard to get people sometimes to eat the requisite, whatever it is, 6 or 8 servings of fresh fruits and vegetables every day that might deliver the substrate for nitric oxide production. So the hypothesis is maybe you can put it into a pill. But then again, sometimes things don't really pan out when there's a hypothesis and, from the drawing board to the, where the rubber meets the road. So this was actually trialed, and I have a copy of the study in front of me. It's a poster presentation, and I'm reading from the introduction. This study assessed the efficacy of inorganic nitrate-containing tablets, Berkeley Life, the brand, to elevate nitric oxide. Bioavailability is determined by salivary conversion of nitric oxide to nitrate. So that's nice. You can get those strips, and you can. What's going on with those strips? How do those strips actually validate this proposition?
Yeah, so, the strips can measure in your saliva how much nitric oxide you have. So, and it correlates very well to the blood levels. So it's just a simpler way of assessing what's your current status or level of nitric oxide. And what we did is looked at the strips at baseline and then put people on therapy, on active therapy or placebo, kind of a dummy treatment, and then assessed it again and found that the patients who were taking the nitric oxide supplement, their salivary levels and their blood levels went up quite nicely.
So that's step one. That's all very good. The strips turned red. I guess it's the indicator color, and that's part of the proof that this is somehow actually getting into the bloodstream, having an impact, and showing up in the saliva that indicates there's something going on. But the next step is to actually demonstrate that there is an effect on blood pressure, because, yeah, fine, the strips are lighting up. That's good. But now in the study, were you able to demonstrate that there actually was an effect on blood pressure? And I think that's the interesting part.
Absolutely, yeah. And that was our primary goal of the trial, was to take patients with mild hypertension and early stages of hypertension, high blood pressure, and see if it got better under this supplement. So in the trial, we followed patients. We followed patients for 3 months, and over 3 months there was a significant reduction in both the systolic blood pressure as well as the diastolic blood pressure. So the top number and exactly, the top and bottom number both went down significantly under the influence of the nitric oxide supplementation, the beetroot extract.
And I was pretty impressed with the magnitude of the change. If I'm reading this correctly, it was about a 12.5 point reduction in the systolic blood pressure. Is that correct? And then in diastolic blood pressure, since that number is lower to begin with, a little less, a 4.7 point reduction, which, by the way, I mean, you're someone who is in the field of cardiology. Would you say that stacks up pretty well compared to some of the commonly used antihypertensive drugs? I would say that's a pretty good result.
Yeah, that's probably comparable to many first-line therapies that we have in the high blood pressure world. At least a 10 millimeter drop in systolic and about a 5 millimeter drop in diastolic.
And what was this group like? Were these people, they were hypertensive to begin with? What was the composition? What was their average age?
Yeah, so there were 67 individuals. They had mild hypertension to begin with. Their blood pressure was over 140, over 80. And then the average age was 59 years old. They were generally healthy people. We were studying hypertension, so they weren't necessarily, they weren't people who've already suffered a heart attack or stroke or anything like that. These were generally healthy people with high blood pressure, and we split them up, randomized them into placebo and active groups, and followed them for 3 months with serial visits and serial measurements of their blood pressure.
And did they have to take like a dozen pills or like, scoops and scoops of powder? Or how many, was it a dosage that was something that people can follow through with?
Absolutely. It's called Berkeley Life, Nitric Oxide. And basically it's a pill formulation. So they just took the pills once a day as part of their regimen, or they were on they didn't know what they were on, or they were on placebo, matching placebo.
Right. And were these people, some of them, or any of them, were they already on blood pressure medication, and this was an add-on effect to what the blood pressure medication did? In other words, is this compatible with being on blood pressure medication already?
Yes. So some of the patients could have been on blood pressure medicine. It had to be stable, but we did show that this complemented traditional antihypertensive therapies, or could be used solely as a more of a plant-based approach for blood pressure control.
So some of them had not been on medication and they had borderline, and then they added this and they got a little better results. And others were on blood pressure medication that perhaps didn't fully control their blood pressure, so this took them a little further along towards optimal blood pressures.
Exactly.
Okay. And so, the concern might be, some people listening to this saying, well, I already take blood pressure medication. Is it possible that if I take a beetroot extract, the Berkeley Life nitric oxide tablets, that this will take my blood pressure down so low that I'm, going to pass out, I'm going to hit the deck? Or is it going to, could have a blood thinning effect, or, any number of possibilities if people are on multiple medications already?
Yeah, so I think this has been generally shown to be very safe. We didn't see any safety issues in our trial, but obviously, if your blood pressure is already very well controlled and it's on the low side, then taking a high dose of this beetroot extract may drive it down a little bit further. But for most of us, our blood pressures are running above 120, so we have some room to go down. And if it dropped it by 10 or 12 millimeters of mercury, you would still be only at a blood pressure of 110 systolic, which is considered healthy. So it's not like it's going to go from 120 down to 60, where you might pass out. It's not that potent. So I don't think that there would be any problem, but of course it's a short-acting medicine. Nitric oxide only stays in the system for a very short period of time. So if you try the medicine and if you try the supplement and you don't like the effects, or you feel a little dizzy, or you don't feel well, then obviously just stop it. I would say we haven't seen any problems, but everybody's different.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share this vital message with you. Are you looking to give your immune system a boost? This is Dr. Ronald Hoffman with a natural solution from Future Farm Botanicals, liquid wild oil of oregano with rosemary extract and natural honey flavor. Future Farm's wild oil of oregano supports a variety of health benefits, including antimicrobial effects, as well as supporting the immune system. Plus, Future Farm is the first ever to formulate wild oil of oregano with rosemary. Rosemary aids circulation, helps alleviate muscle pain, improves memory, and also gives your immune system a boost. The natural honey flavor enhances the taste while still giving you all of the benefits. Future Farm sources this product from the Mediterranean and produces it in the United States. For more information and to order, call 888-841-7216, 888-841-7216, or go to myfuturefarm.com/Hoffman. That's future, PHARM, myfuturefarm.com/Hoffman. Wild oil of oregano is all natural, science-based, and works without adverse side effects. myfuturefarm.com/Hoffman. Thanks for listening, and thanks for supporting our sponsors. They're what make intelligent medicine a continuing free resource to you. And now back to our guest, Professor Matthew Budoff. So, in your practice, I read a kind of a stark statistic recently, is that a very, very high percentage, high double digits of Americans have borderline or elevated blood pressure, and are simply not taking any measures to correct it. They're either, doctor shy, or maybe they can't afford the medication, or maybe they're in denial. They don't like the side effects of medication, or they just it's not been discovered that they have high blood pressure. Can you comment on it?
Yeah, no, absolutely. There's a lot of people who are running around with some version of labile blood pressures or and it, bounces up and down. And this, I think, would be excellent for those type of patients who might have intermittent hypertension, where it's not always high, but maybe it's only high when you see the doctor, or it's only high when you're under certain stress. But I think there's harm there. Whenever the blood pressure goes too high, the blood vessel wall takes a beating, and over time it can wear out and cause problems like heart failure, like stroke, like kidney problems or eye problems. Yeah,
they say it's the silent killer because really it comes on unawares. Some people get kind of a headache or a dull sensation, band-like sensation around their head or the back of their head that lets them know that their blood pressure is high. But for a lot of people, they're relatively asymptomatic. And I say to people that sometimes it's a little bit like the formation of the Grand Canyon. It didn't form overnight, but over a time there's sort of an erosive effect. And you can dig a deep canyon. The same erosive effect occurs in all your blood vessels in your brain, your kidneys, your heart, and so on.
Absolutely.
Indeed. So when it comes to nitric oxide, is there a reason that older people get higher blood pressure? There's probably a lot of reasons. People become more obese, they're more sedentary, the regulatory systems in their body wear out. But is there evidence that as you age, your nitric oxide levels are depleted?
Yes, I think there's two factors. One, as you age, your blood vessels, slowly get a little stiffer, and your arteries get a little stiffer, and your blood pressure may drift up. And I think also naturally, some of the healthy things like nitric oxide levels drop. I think it's probably a combination of both as to why your blood pressure, goes up over time in most patients.
So that's been demonstrated that there's a lack of synthesis of nitric oxide with aging, right?
Yes.
Yeah, and also I'm doing a little investigation with some of my patients of their genetics, and actually there is a little genetic variability, isn't there, with something called INOS, which is the nitric oxide synthase, which makes nitric oxide.
Yes, absolutely. Yeah, it's been under a lot of interest over the past year or two.
And in fact, if you have a double hit on the gene which impairs your endogenous production, your own body's production of nitric oxide, statistically you may have a higher risk for hypertension or cardiovascular disease or even erectile dysfunction, from what I understand.
Right. And this is kind of, really solidifying the concept of the importance of, nitrous oxide, and the vascular effects of having a lack of it or having low levels of it.
Yeah, the very people who have a deficiency, they have so many problems. And again, we're not going to be one-note Charlies about this. There are a lot of factors that go into the hypertension equation, but certainly that is an important one. If we can address it and alleviate it, that's going to be at least part of the battle. Okay, so we laid the groundwork for a discussion of nitric oxide as a plausible way of supplementing and supplanting our body's own production. We're talking today to Matthew Budoff. He's a professor of medicine at UCLA and an expert on cardiovascular prevention. In fact, he is the endowed chair of Preventive Cardiology at Harbor UCLA Medical Center. So when we return, more on the subject of the nitric oxide connection and research that he has recently co-authored and performed on nitric oxide supplements. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. This episode of Intelligent Medicine is brought to you by Healthy Aging, providing you with the unique energy support of Pure NT Factor. NT Factor is the only nutritional formula clinically proven to reduce fatigue, whatever the cause, whether it be age, illness, or just being run down. NT Factor from Nutritional Therapeutics repairs damaged cells and restores healthy bacteria in your digestive tract. Clinical trials have shown NT Factor reduces fatigue by almost half, and it even reverses some symptoms of aging. I've been taking NT Factor for years with a 45-day money-back guarantee of nothing to lose. To order, call 800-982-9158. That's 800-982-9158. Or go to ntfactor.com. That's ntfactor.com. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're talking to Dr. Matthew Budoff. He is a cardiologist, and he is at UCLA. He's the endowed chair for Preventive Cardiology at Harbor UCLA Medical Center. So, Dr. Budoff, what are some of the preventive strategies that you're working on in your research at UCLA for in the field of preventive cardiology? What does that entail?
So, my day-to-day work, I'm trying to work on new therapies that will help prevent people from ever suffering a heart attack or stroke. The number one cause of death for both men and women in the U.S. and actually in the world is heart disease, and we certainly want to try to continue to find new therapies that can help us in that battle to reduce the risk and give people longer life.
So in addition to, diet and exercise and stress reduction, all the usual verities, avoidance of smoking, the tried and true lifestyle methods. You have a particular interest in the potential for nutraceuticals to have an impact on cardiovascular wellness. So I think it's kind of a natural for you to study the effects of nitrate-containing tablets. In this case, Berkeley Life makes a nitric oxide supplement. And so your recent study actually validates that. And, one of the things that I appreciate really about your work is that, you're kind of a bridge between the natural products community and academe, because what we need well-conducted studies, double-blind, placebo-controlled studies like this to validate some of the things that we believe are helpful. So appreciation to you for engaging in that kind of work. So what if you were to design a program of nutraceuticals that would support cardiovascular health? I know that nitric oxide tablets would be front and center, but what are some of the others that you think would be plausible for people who are trying to avoid cardiovascular problems?
So I mean, obviously, you had mentioned some of the key things we always focus on: diet, exercise, maintaining a healthy weight. But there's a number of nutraceuticals now that really can help supplement what we do and help us in our long-term battle. We've been studying this beetroot extract, to develop a way to get increased nitric oxide into the body, because a lot of us can't eat enough fruits and vegetables. So I think there's an opportunity there to really improve for those of us who don't have the optimal diet, or for those who feel they need additional supplementation in that regard.
Right. So these Berkeley Life tablets, they include nitrate-rich beetroot extract. I'm looking at the ingredients. Thiamine nitrate and potassium nitrate with a little bit of ascorbic acid. How did your team arrive at that ideal formulation? What about it makes it more bioavailable or potent?
Yeah, so it's a combination of I think, as you mentioned, bioavailability. The ascorbic acid helps get it into the system so that we don't degrade it when we first take the tablets. Both the thiamine and potassium are also supplements, but the main ingredient, the largest ingredient, is really the beetroot extract, and that has the majority of the nitric oxide, the inorganic nitric oxide that's then rapidly converted into nitrous oxide in the body.
Have you done any equivalent studies to determine how many beets one would have to eat, or how much beet juice would you have to drink, or how big a serving of arugula you'd have to consume to get what you're getting from these tablets?
Yeah, it's a great question, and obviously there's a lot of variables there, and how exactly what sizes and maybe what variety of different. There might be some differences, but you probably have to have consistently multiple intake of each of those, or at least of one of those each day. So it would have to be a daily intake of the beets, daily intake of arugula on a regular basis, and probably multiple times a day to really get enough to change your nitric oxide levels over the course of a 24-hour period.
And I've heard that the use of mouthwash can sometimes interfere with the conversion of dietary nitrates into nitric oxide. Is there something to that? Is it, if people are taking this, that they should forego their Listerine?
Yeah, I mean, unfortunately, a lot of the products have either alcohol in it or other things that are meant to help us fight germs and bad breath, but they end up breaking down.
Antimicrobials kind of things, yeah.
Exactly, right. And then they end up breaking down some of the products. So, yeah, I would definitely not take it not take it right before I brushed my teeth or did a mouth rinse, just to make sure you get full absorption. It is absorbed fairly quickly, so I'm not too worried, but you certainly don't want to do it, and then take a big swig of Listerine.
So we're focusing on hypertension because that's an easily measurable parameter. But are there any other systems of the body that can be impacted by adequate nitric oxide? I mean, it's a signaling molecule that's ubiquitous; it's everywhere. So, are there other potential benefits to circulation, to athletic performance? It's even been claimed potentially for sexual performance.
Yeah, and I think as we had mentioned one point earlier, the high nitric oxide levels may is kind of how the mechanism of Viagra, and that's related to potency or treating impotency, I should say. But I think the big wins that we think about with high nitric oxide content is anti-inflammation. We know that inflammation is a chronic problem that really can hurt multiple organs. We know it can cause atherosclerosis. We know that it's, a disease that can come from many different places, including things like gingivitis and joint inflammation. And chronic inflammation goes down under the effect of beetroot extract. It's also been demonstrated to help with digestive health. So improved
via the microbiome.
Exactly. Improving our ability to absorb better nutrients and overall having a healthier long-term physiology.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share this vital message with you. This episode of Intelligent Medicine is brought to you by the Protocol for Life Balance product line, available at my online dispensary. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research. Among them, several stand out, which help support positive mood and relaxation. GABA, 5-HTP, SAMe, L-tryptophan, and mucuna extract. With current economic and living conditions causing widespread sadness and tension, these neurotransmitters and their precursors can help support positive mood and relaxation. That's according to numerous clinical studies. Their ingredients are backed by solid scientific data. They're only available from healthcare practitioners, but they're available to you at drhoffman.com/protocol for life balance. That's drhoffman.com/protocol for life balance. Thanks for listening, and thanks for supporting our sponsors. They're what make Intelligent Medicine a continuing free resource to you. And now back to our guest, Professor Matthew Budoff. I don't want to move into dangerous territory here, but, I've been looking at a lot of the possible mechanisms that may be involved in immunity and susceptibility to viral infections, and then ultimately this devastating path that some patients take towards cytokine storm and respiratory failure and ultimately death. From my reading, nitric oxide is involved there. Again, we don't want to make, fantastic claims that nitric oxide is some sort of bulwark against COVID-19, but is nitric oxide metabolism part of our overall resilience to viral pathogens?
Yeah, I mean, obviously we're still learning quite a bit with this new virus and this terrible outbreak that we're all going through together. But yes, I think inflammation and as you said, kind of an inflammatory storm really is probably why some people do so poorly with this infection, and whether having higher levels of nitric oxide would be one way of circumventing that, or maybe taking therapies that reduce inflammation. These are things that many people around the world are looking at, but I don't think we have all the answers to yet. But I think it's at least plausible that therapies that have an anti-inflammatory property would be beneficial potentially in blunting some of the worst cases of this disease.
And I'm also curious why in your attempt to address this nitric oxide deficiency problem and to augment nitric oxide, that you haven't taken one of the routes that's commonly taken in nutritional supplementation, which is to look at arginine and citrulline as ways of boosting nitric oxide. Is that not a useful way to do that, or is it less important in some way?
No. I think there's alternative ways of doing this. I think arginine has been, we've done some studies with some garlic products with arginine supplementation as well. I think there's definitely different ways of approaching this that could be helpful. We were kind of working with Berkeley Life specifically to help validate this formulation, which is obviously primarily a beetroot extract formulation. But there's definitely multiple ways of getting around this or getting to this benefit. And I think the arginine pathway is robust as well.
So you see, it's sort of like all roads lead to Rome in a sense, is that you can get some augmentation through arginine, citrulline, but it's a little bit of a different pathway, and you can come at it in a different direction by using the dietary nitrates, right?
Absolutely, and I'm interested, potentially in looking at supplements that might have multiple pathways and seeing if we have even a larger effect, if these are complementary to each other, or if they're competing, where if you're doing one, doing the other one isn't going to really add that much value. We need to look at that as well.
We don't even know yet, so this is a subject for future research.
Absolutely.
And so, I work out extensively. I'm trying to maintain my fitness into my 60s. And I take the Berkeley Life product prior to workouts. So am I deluding myself to think that in some way I might have better endurance, better stamina, better circulation, improved?
No, I think there's definitely. Well, we've seen, so one of the things that we did measure in our formal test, we didn't only look at blood pressure, we also looked at the effect on the blood vessel health. We looked literally at how well the body responds to and the arteries open up under the influence of the beetroot extract versus the placebo, and we did see a much more robust response.
So the endothelial reactivity, right? It's called endothelial.
Exactly.
Right. So the stretchability of the blood vessels, right?
Right, and we looked at brachial flow, and then how well it dilated after being compressed by a blood pressure cuff, so the reaction after a stimulus, and we found a much more robust response within the biggest response was in the first 2 hours. We saw a sustained response over the 12 weeks, but we saw the biggest response immediately. So I think taking this, prior to exercise, taking this, to see a somewhat immediate effect, we did see that. We did see and we didn't measure it at, 30 minutes or an hour. We just did a 2-hour test, and then followed them long term. But we did see a reduction, an improvement in blood vessel health at our 2-hour mark. So I think taking it before you exercise or before you, do something where vascular health may be important does have a basis in some of the work that we've done and other work as well, of course.
Now, some people might get confused because they scrupulously avoid nitrite bacon, right? Because that's also a related compound, or is it the same thing? And are they misguided in trying to avoid nitrites, dietary nitrites versus dietary nitrates? I'm a little confused about the terminology myself.
Yeah, nitrites are very bad for you. Nitrates are good for you, but they're not directly the same. So,
so it's like one letter difference, right?
Exactly. No, I think, unfortunately, we have sometimes things happen like that where they sound similar, and it lends confusion to everybody, not only to you and your listeners. We all get confused by these, and then when you're speaking about it, people may mishear you, and it's one letter off, and it's much different. It's the exact opposite.
Right, because some people are saying nitrates. Yeah, I mean, I'm avoiding that bacon that has that bad stuff in it. You know, it's like I want my bacon to be uncured and nitrite free. That's different. Okay,
right.
So okay, and then especially when you heat the bacon at the high temperatures, and chemical reactions can occur that render it carcinogenic or harmful. Okay, so let's sum up the results of the study. Study looking at 67 individuals, average blood pressure, moderately high, borderline, good results with simply taking a couple of Berkeley Life tablets in the morning, presumably, before starting the day. Systolic blood pressure down 12.5 points from my reading of this study, and diastolic blood pressure down 4.7%, and no interference with the use of other antihypertensive therapies. So that can be an add-on therapy, it could be a standalone therapy, depending on how bad your blood pressure is.
Absolutely, yeah. I think you summed it up perfectly. Yeah, and definitely supplemental to traditional therapies, or as a complement to a more of a plant-based dietary approach for blood pressure control.
Okay, great. So where can people get more information about this study? Is there?
Yes.
Go ahead.
So it's there's a website, berkeleylife.com. So BERKELEY life, all one word, .com. They have a tab at the bottom called Clinical Studies, and you can find out more. And they have some of these studies, as well as a few others that have been done to demonstrate the benefit of the therapy and how nitric oxide can help us support our heart health and vascular health.
Indeed. Great stuff. And incidentally, since I've discovered this, by the way, and I will mention this, and there are a lot of brands of beetroot extract out there, but this is the one that I use because I believe it's really the professional type of supplement that health practitioners use. It's not really available over the counter. It's available through healthcare practitioners, as far as I'm concerned. It's available via FullScript, which is our online dispensary to intelligent medicine listeners. But it's probably not something that you're going to find in Costco. Right?
Right, yes, and I think and the company has funded a number of studies to really validate their product, and I think that really should lend a lot of confidence to the consumer that this is not just a pill that's coming off the line that has no validation, that's trying to ride the coattails of some of the more well-controlled or well-performed studies.
Mm-hmm. That's very well said. And, and credit to the Berkeley Life people that, they're willing to invest the time, the resources, and frankly, make a financial commitment to validating the therapy that they're advocating. Because, nutritional supplements, they come and go. And some of them are based on sort of, some supposed benefit or some folkloric benefit. Natives in Tahiti took this and they lived to be 110. This is not of that type. Right.
Exactly.
All right. Great stuff. Thank you very much, Dr. Budoff, for joining us. Dr. Matthew Budoff, professor of medicine at UCLA. Thanks for joining us. Really appreciate it.
Oh, it's a pleasure. Thank you so much for having me on.
Great. Enjoyed talking to you. I'm Dr. Ronald Hoffman.
Take care.
Yeah, you too. Stay safe. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. Hi, this is Dr. Ronald Hoffman. As you know, this is a vital time to bolster our immune defenses. I've received countless requests for a specific list of supplements that I recommend to support immune health. That's why I've created the Intelligent Medicine Immune Support Protocol, my supplement recommendations offering the greatest boost for your immune system when it's needed most. Best medicine is preventive medicine. Just go to drhoffmanstore.com for more information. drhoffmanstore.com. In addition to the immune support protocol, you'll find easy-to-follow links for our supplement starter kit, heart health protocol, and much more. These protocols are an easy way for you to get the exact combination of targeted supplements you need to help you follow the intelligent medicine lifestyle. The same supplements I take for myself and prescribe for my patients. And for a limited time, you'll get free priority shipping on all of your store orders. For more details, just go to drhoffmanstore.com. That's drhoffmanstore.com.